Well, we are the Cornerstone Health Team, and the four of us women, all with different health backgrounds, we really realized that we had a passion for health. And not just for health, but a passion for prevention, really, is what it was. And between the four of us, we have 21 kids. And so it was really important to us to obviously keep our kids and keep our family healthy. But what we realized is that it wasn't enough just to keep our family healthy. Most people don't realize that our health is being challenged 24/7. Literally on a daily basis, we are surrounded by environmental things and the quality of our food and our water and our air, and it's everywhere, and it's hard to escape that. And so we came together and decided that we were going to develop some classes and really bring it back to the basics and explain to people simple things that you can do on a daily basis to kind of help combat those things that we're up against. Making sure you get enough sleep and the amount of water, and how to make good food options, organic, non-GMO food options.
When we came together, one of the biggest reasons that we came together was when we were working with other people or talking to them, we realized they didn't even understand how their body worked. And so if you had a problem inside of the body, they didn't even know why it was. One of the biggest things that we talk about is digestion. And as we were just told today, it's the number 8 organ. And if that's not working, it has a direct line to the brain, and the brain's not going to function properly either.
I like to look at health as a puzzle. And there's pieces. There's good sleep and exercise, healthy choices, all of that. And when you put that together, you've got a beautiful picture. And so when you go and do these classes, and we got together for a whole summer
and
to put our cars on autopilot, and here we go once again. We know that when you're going to help people make a difference, it has to be fun. It has to be exciting
and memorable.
And so I'm a school teacher, so I know that you need visual aids, and you have to have that. And so I guess the most fulfilling thing is when you have people come back from the classes and say, oh wow, I'm not going to touch that pop again because I remember what you did in that class, and the healthy food choices and all of that.
And I think too, another big part that brings us together is looking past the now and into the future. Mm-hmm. When we have young kids and we have, who knows, grandkids, whatever, next generations, is we wanted to let people start making a difference now that would affect other people's lives. And I know the experience I went through that was very personal with my son, with that major health condition that he went through. I so know that if people would have been more educated, they would have made other choices that affect other people's lives. We just never know where our actions, for the good or the bad, can
affect other people.
Can affect other people. And I want to be on the good side.
That's right. And I think what you said too, Anita, about being conscientious of what we're doing, it's not about us. It's really about sharing the knowledge that we have so that we can pass it on to other people. Because a lot of people just plain don't know. Mm-hmm. I mean, like you said, the examples and stuff. This is just one of the examples from one of our classes, and this represents the villi in our small intestines. People don't even realize that we have these villi, and that is where the nutrition is absorbed into your body. If those are damaged, you're gonna have problems.
Mm-hmm. All health starts in the colon. You hear it many, many times throughout our classes.
And the class I dress as a police officer because that's kind of depicting how your bowel movement should look. I go into how, if it's looking like this, like Mr. Bodybuilder, you need more water. And Miss Diarella has, there's issues there, and how you can solve that problem or
solutions.
That issue. Yes, solutions to the problems. And were you dressed as an engineer? So.
Yep, I have an engineer hat because I start talking about digestion. We take you through the whole process from mouth all the way through. And so I, talk about things in the mouth and how we digest, start digesting carbs right away because of the enzymes in our saliva. And the key thing, and the reason for the engineer hat that I wear, is that we want people to understand that you need to chew your food. watch people eat sometimes. Everybody is always on the go, on the go, always constantly. And what you don't realize is that your body cannot process and digest and fully utilize the nutrients and all of that from your food if you are not chewing it well. So chew.
And then another class that we do is the Kids Health Adventure class, where we are the captains on a ship, and they are all coming on a treasure hunt to these different, and they leave with little prizes and a scavenger hunt and everything like that. And it's so nice and rewarding to see young children learning some just basic things that will, if they take them through the rest of their, remember them the rest of their life, they will be well better off.
And they go to the digestive island, and then the yummy island. The yummy island is the GMO. They know the difference between the GMO and the non-GMO, and the water island, and they get a little treasure in their
they get a
ditty
treasure
bag
in their
every time
ditty
they go
bag
there.
at each island,
Yes.
and they get just giddy over those treasures. And
Well, and they get to meet.
Captain Cole, he's our little parrot.
Yep, so we have a parrot that
Might
shows
be in
up
there
in our class,
somewhere.
too.
Yes.
So yeah,
So
that's
maybe
probably our
introduce yourself.
funnest class that we enjoy that one the most. I think it's fun to interact and to teach the kids and just have fun doing that class.
Anita and I are sisters. My name is Brenda Cronenberg,
And I'm Anita McNamara.
and so we've known each other for a long time, and we've had kind of an interest in health and kind of having the same frustrations at the same time on a few things. And
And Letitia and I go back, I don't know how many years, as just, well, not just, but friends. Friends, very good friends. And Maria, you met Letitia.
My parents, my family were very good friends with your family, and so that's what kind of brought us together, and we just all sort of came together.
And we found out that with our personalities, everybody brings something different to the group, and
we're a
it's
square
just-
with actually 4 corners.
Yeah.
Hence the name Cornerstone.
That is where the name came from.
It was painstakingly put together, but when it came, it was like, oh.
Yes, that's it.
And the team part of it really was because we do feel as a team, I don't know that we could do this without the other person.
Separately.
We each pull in something
Yes,
that adds
yes.
to it.
And we keep that focus that we are a team and stuff. And it's amazing what ideas come from
And
everyone.
when Brenda, our financial advisor, comes and tells us the pennies, so we all have to say, well, we're not in this for the money, and we all have to agree, yes, that's true.
We literally sat in my office at home and got a piece of paper out and said,
Good.
what do people really need to know about? And it started with digestion, and we drew and made a list. And then from there, we wondered what else is really important? What do we really need people to know about? And that's where the equation came from. And the class came from that equation. So each part of the class kind of has a part of that equation in it. And then we realized that, well, this is just going to be really dry and boring if all we do is sit and talk to people.
It gets really heavy. I mean, it's health. It's important. It's a touchy subject for some people, and you have to keep it light and fresh and
You're touching on
memorable.
personal matters.
Exactly.
And so if you come in wearing weird costumes and
hats
and hats, well, they're not weird, but I mean unusual. When people are coming to a health event, they're not expecting people to wearing police officer uniforms.
construction
and-
hat and police officer and
and a chef
hat.
hat.
It all intertwined.
And then what we also noticed that, people really can't always determine it from the inside. So the eye twitching would be a lack of, eye twitching up here and our eye twitching down here, kind of what your body is screaming for or calling for. And so we explained that.
And hangnails. And
Hangnails
everything-
is
and
vitamin C.
Vitamin C.
Vitamin C. Get a lot of hangnails. We know someone that they see the hangnails coming, then like a week later, if all of a sudden they have a cold, they're lacking that vitamin C, that antioxidant.
It's little signals like that. If you know what it is, you can make an adjustment rather quickly and ward it off. So.
The key is to catching those things early enough and preventing the big health problems, the cancer and the diseases and all the different things. I mean, we are bombarded, and sometimes you just feel like it gets worse by the day because you're always hearing about new diseases you haven't heard of and new cancers and all these. Oh, I have this friend who has this, and nobody's even heard of it before. And so it's really important to us to get this information out.
There was a mother that was here today, and it was so funny
that's
because she came to one of our classes, and then we sat down with her, and she has an 8-year-old boy, and many problems in school, attention, focus, couldn't keep his hands to himself, and all of that. And so we sat down and targeted the digestive tract and gave her solutions. And I talked to her today, and she said since school started, we haven't had one phone call. He is back in the classroom, and it's all
He's
fantastic.
seriously mainstream now.
Yes, she is very excited.
Such
So,
a
yes,
drastic change that family members and friends and stuff are pointing it out and saying something because they see the change in him.
Yes.
And for that family, that class was it made a difference.
And so
It was definitely
sometimes
one
it
person
was
at a
just
time.
interesting because sometimes she would call. She said, "Well, he's acting up again, or kind of, are we going forward or are we going backward?" type of thing. And we said, "Okay, just for 1 week, just take account of everything he puts in his mouth." And she was very good, and it's so nice to work with people that just. So she did, and then we sat down and said, "Well, he is consuming this amount of sugar, and can you get 2 quarts and fill that with sugar and see what that is, and then find out the sources." And then she made that concerted effort to not give him sugar and to change his diet here and there, and more water and exercise, and yes. Very
It
happy.
made the difference. Yeah.
So that's where we offer solutions. Well, the first one is basics of reading your body. And so we explain the signals that your body gives you internally and the signals that your body gives you externally. And so we explain that, of course, with all the visual aids. And then the next one is the basics of building your health. So if they've gone to our first class and have noted that, yes, digestion is really important, and so then that's when we kind of tailor it to their needs. And we tell them what nutrients are very important, especially what we're counteracting with the food and the water and all of that. And that's where we kind of sit down with them and target the different issues. And then we have the Kids Adventure class, which is a very popular class because whenever we have it, it's always full. And that, of course, is a very popular one. We have worksheets that the kids can fill out, and they get a ditty bag when they go in there. And they follow us as if we're on a ship, and they sing as they go behind us as we go to the next island. And what's so exciting about that is when the kids actually are making the decisions for the grocery shopping, healthy decisions.
And the things they remember weeks later, the parents will come back and be like, "We're in the grocery store and so-and-so pulled something out of the cart," and they're still able to identify the organic and the non-GMO and the labels on there, and just like that's incredible that little kids are remembering that how many weeks later.
And not just that, but we also talk a fair amount about colon health. And so children are coming back to their parents saying, "You know what, it looked like this person in the class." And so the parent is on top of it, whether they have the bodybuilder or Miss Diarrhea or whatever, and the parent can take care of it too. So they know what it should look like. And if it doesn't look like that, they know to go to their parent for the answer.
And right now we have, wherever our sign is here, we have our next class, Basics of Reading Your Body, that we are doing December 2nd in St. Cloud here at the Rasmussen College. So that's the next one we have scheduled. And then we'll also come the first of the year in January, we're going to try something a little new, and we're going to try doing our class via a webinar. So, that's going to be new, so we can reach a lot farther and out there to a lot more people. So that's something new that we're going to be working on. And of course, we are always welcome to any community organization or business or just anything that is interested in what we have to offer. And they can contact us, and we'd be happy to come to them and to do a class for them.
If we're always open to talking to people too, and just helping them hopefully solve some problem. If they just need somebody to talk to and ask, like, where's a good resource? Along with the Health Summit. I mean, this is our second annual Health Summit that just concluded today. And we like to bring in speakers that have pertinent information that people need to know about. And sometimes they might be a little controversial, but it's up to people to take the information and do with it what they feel they need to.